Hello, everybody, and welcome to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your host, Corey Ray Kovacs, registered nurse and women's wellness mentor and educator. And I am here today with one of my friends that is also an amazing human being who I have gotten to know recently, and her name is Dr. Natasha Stamper. She is a clinical pharmacist and online fertility medication educator. She found her love for all things fertility while living in a remote Alaska village, navigating her own IVF journey alone. After many miscarriages, 2 ectopic pregnancies, and 1 cervical ectopic, she has had her 2 miracle babies. Now, with over 12 years of clinical pharmacy experience and her own experiences, she is so excited to be helping families all over the globe fulfill their dream of making their family complete. Well, welcome to the show, Dr. Natasha. So happy to have you here.
Thank you so much for including me. I'm super excited. Thank you.
Oh my gosh, it's been such a pleasure getting to know you and seeing just this beautiful mission you have of supporting women and giving them this unique perspective that you have from both your professional experience and your personal experience in managing the difficulties of medications through fertility treatments. I would love for you to tell us a little bit more about your mission to support women through their fertility journey with their medications.
Yeah, so thank you so much. I like to tell my patients one of the biggest costs of IVF or infertility or any type of fertility treatment can be the medications, right? And a lot of people, it's the most unknown. Even for me as a pharmacist, I remember getting my giant box, and actually, I didn't get it in the mail because I was living in a remote Alaskan village. I got it from the
Right.
clinic that I had it shipped to, but I didn't know what to do with it. Like I took it home, and it was like I could just put this in the corner and I could forget about it because it's overwhelming. I don't recommend that because there's things that need to be
Right.
done, right? Refrigeration on some or whatever. And so it came to me quickly, even as a pharmacist, and my husband's a pharmacist. As the patient, I had no idea what I was doing. I was like, what?
Mm-hmm.
And I remember the nurse teaching me all the things, but it was such a blur that by the time I got home, I was very overwhelmed. So I just, talking about my experience has helped heal me, if that makes sense. So being
Mm-hmm.
able to help women and to say, don't be overwhelmed. Let me help you is great. So one of the big things that I do with women is I've helped do supplement plans. I help teaching the medications. I can do even virtual appointments where we go through the medications together and unbox them together. So there's lots of opportunities out there and different things. And I try to tailor what I help families with each person, but yeah, it really lights me up. And then just marrying it with my education has really helped. I think what started this was COVID. I wasn't able to
Right.
see patients, right? So we couldn't see patients. We would just so my day job I don't talk about a lot, but I work for Indian Health Services.
Mm-hmm.
And so I'm a clinical pharmacist there, and I wasn't able to see my patients face to face. And that was a really turning point for me. It made me unfulfilled. And so turning my passion, fertility and fertility medications, really helped me get through that slump. And then a side effect of that was that it kind of healed me talking about my own journey.
It really does this opening up of yourself, and sometimes fertility, I know in my personal experience, that process, just going through that felt so isolating and like kind of hardened myself to the external world. And it wasn't until I started really sharing my story that started to open me up to healing those wounds that were created during that process. It is extremely difficult to go through. So and then COVID
Yeah.
COVID added this unique, as healthcare professionals, right? We were used to being with patients, used to talking to them, and then all of a sudden we're at home or we're at our computers, and so having to get creative. I love that you've found a way to be able to work with women, and the idea of unboxing unboxing your fertility meds or your IVF kind of packet or box is like, I don't know. I get it that it's an overwhelming process, but it sounds like you kind of make a ritual out of it, or a thing that's like, okay, well, I'm here for you to support you through this. This is I know it's scary, but I'm here for you. And
Thank
um,
you.
that's really a special thing. And I love that you're doing that for people because those medications can be really overwhelming. So let's talk a little bit about these medications, particularly for women who have PCOS. We know that one of the biggest reasons why we struggle with fertility in PCOS is our ovulation. We
Mhm.
struggle to ovulate on a regular basis, or we might be anovulatory, almost completely. And obviously, we know in order to get pregnant, you have to ovulate. So there's so many things, of course, that we've talked about in the summit to help support your fertility, through nutrition, lifestyle, reducing stress, and addressing your root cause. But sometimes you also need supportive medications. This is where you come in and educating us a little bit about these medications. So for those of the listeners that are maybe just starting off their fertility journey and they've maybe talked to their doctor and some medication names have been thrown around, let's talk about the main ones here and really kind of unbox and unpack that, so that way we can remove the fear and get down to the nitty gritty of what these are about. So
Right. Thank you.
talk
And
to us about these medications.
yeah, I love that you said we understand that lifestyle and mindset and nutrition
Mhm.
are the key. Because that in my mission, I'm a terrible pharmacist. I hate pills. So that is my mission also. But
No, you're not
the
terrible.
realistic,
We need that. We need that authenticity. Don't
yeah,
You are looking at this as pharmaceuticals are here to assist, but
yep.
there's
It's a
other
tool,
things that
right?
we
In our
can
tool
do.
belt. Yep.
Yes. Yes. So
So
keep doing
yes,
what you're doing, sister.
thank you. So, like I was saying, realistically, sometimes, structurally, possibly, or different
Mhm.
reasons, we have to use medications, right? And they're thrown at us daily. We see them in commercials all the time, popping up on our phone, medications, because a
Mhm.
lot of companies make money off of that. The main medication, and one of the oldest I like to talk about, is metformin. So, metformin can be rough, right? We've heard
Mhm.
it can cause a lot of side effects, and I'll talk about those. But first, I want to kind of explain what metformin can do for you with PCOS. So, it's one of the most common, first
Mhm.
of all, like first line, I would say that a provider will give. Um, People with PCOS often have problems with insulin sensitivity, right? So metformin will help with that. And high insulin levels can then increase androgen levels, which interfere with ovulation. We know that too, right?
Mhm.
And so taking metformin can help with that. The problem with metformin is it's a big, chalky, terrible pill. Like it's ugly. I
Mhm.
check them all day, every day, and they're like horse pills. They're hard to swallow.
Mhm.
They cause a lot of GI side
A
effects.
lot.
A lot, yeah. And so some tips I like to give people, I wouldn't be afraid of metformin. I'm not trying to scare people.
Mhm.
I think metformin is great. I think that it's a good starting point, and I think
Yeah.
that it can help a lot of women, even just to help with inflammation, that insulin sensitivity resistance
Mhm.
problem. Um, and if it can help women get pregnant, it
Mhm.
has, right? We've seen
Yeah,
that.
absolutely.
So some tips I like to say are um, ask your doctor for extended release metformin. So
Mhm.
there's immediate release and extended release. Immediate release you would take twice a day, extended release once a day. First of all, it's easier compliance to remember. And
Mhm.
second of all, there's not as much side effects with that extended release because the pill is coated with a thick coating and it
Mhm.
kind of releases slowly over time. So maybe you won't get as much of those GI side effects.
Right.
Another thing I like to tell patients is take it in the evening so you can sleep through some of the side effects like
Mm.
diarrhea, stomach ache, cramps, those kind of things. And then if it's just not working at all, talk to your provider because there is other things you can do for PCOS. This is just a
Absolutely.
start point.
Absolutely.
The next one I always like to talk about, it's an oldie, is Clomid. So
Mhm.
Clomid is a selective estrogen receptor modulator.
Mhm.
So it tricks our body into thinking that um, we don't have a lot. Well, it doesn't trick our body, but it goes to our brain and tells us that
Right.
our estrogen levels are decreasing. It comes in a 50 milligram tablet, and it's
Mhm.
usually prescribed at the beginning of the cycle.
Mhm.
It can be on days 3, 4, 5. And it can be given in a range of 50 milligrams up to 250 milligrams. So it just
Mhm.
depends. I think what I've read in the past is that providers will use Clomid up to like 6 cycles, and then maybe they'll
Mhm.
try something different.
Yep, I was going to say that typically you can use that Clomid about 6 cycles. If and beyond that, they don't find that there's any increased chance or those chances decrease as we get further out there. So 6 is about how many that a provider will do.
Yes. So what it does is it works by making your body think that your estrogen levels are lower than they are.
Mhm.
And so this causes the pituitary gland to increase FSH and LH.
Mhm.
And then that helps with our ovulation. So that's follicle stimulating hormone and luteinizing hormone. So
Right.
a lot of technical things in there, but basically the end result is we want to increase ovulation. Unfortunately, there is some side effects with Clomid, like a thin uterine lining, and so that can negatively sometimes impact pregnancy rates, right?
Mhm.
We know that. Hot flashes, blurry vision, bloating, headaches, a lot of nausea sometimes. I get a lot of people telling me about the headaches. They say that that's pretty bad.
Mhm.
I didn't personally take Clomid in my journey, so I wasn't able to share with what I experienced. Maybe you did, and you could
I
share something.
did, yes. So I did. I actually only took Clomid one cycle because the side effects were so bad. I was still in the military at the time. I was an instructor in Intel school, and I literally was like laid out on my desk drooling because I was so
Mm.
nauseous and the headaches. I had migraines for 2 weeks after that, and I felt like crap. And I had to go back to my fertility specialist and I said, I cannot do that again. If I have to take that again to get pregnant, I like literally at that point, I was like, I can't. I literally cannot do this again. So, and I know that so side effects, if you're listening and you've had, maybe had a round of Clomid and you want to stick it out, like just know that you like talk to your provider about what you're experiencing because your quality of life, how you're
Mhm.
living now, also matters. And if you like, there's other things that we can try, there's other things that we can do, and we're going to talk about another medication here in a minute. But just know that if you're having these severe side effects that are drastically affecting your ability to function, then talk
Mhm.
to your provider so we can find a solution. Because it's yes, we want to get pregnant. We want to have that baby, but also you're living life now too. And we
Yeah,
can
if
find a way to support you in that. So
yeah,
just be
and
aware.
I think if people have followed me for a while or listened to other podcasts I've done, I always say, like, one of my biggest things is we are paying the provider. They're working for us.
Yes.
It's hard to speak up, but we are paying them, right?
Hmm.
And you need to speak up and advocate for yourself. Always advocate for yourself and loved ones. That's my main thing, one of my main things.
Absolutely.
And say, hey, I mean, maybe don't say, my friend told me this works. Just say, I can't handle these side effects. Be off,
What can we
honest.
do? What are my
What can
options
we
for
do?
me?
Yeah.
What are the
Yeah.
options for me? Of course, like everybody that's been here at this summit knows I've literally talked about advocacy almost every single interview because this is also one of my passions and why you and I connected so strongly is because of this advocacy and speaking up and really seeing yourself as the key player in your healthcare team.
Mhm.
It's your body, it's your health, it's you. So take those questions, be honest and open with them and say, what can I do for my case, for my situation that we can do differently? Or, how can we manage this better for me?
Right.
So,
And if it comes down to it and you don't feel comfortable, look for a different clinic.
boom.
I have a whole thing on one of my courses that I did about choosing a fertility clinic and what questions to ask. So
Ooh, that's
do your
fantastic.
research. Yeah, we could
Yes,
talk about that on a live later or something. But so
absolutely. I would love that.
yeah, the next medication that is more mainstream is Femara, also called
Mhm,
letrozole.
mhm,
So Femara was you might hear it as a breast cancer drug, and so that might
mhm.
scare you, but we do use it in
Certainly.
fertility. And it also lowers estrogen, and it does this by blocking the enzyme aromatase, and then
Mhm.
that will induce ovulation.
Right.
So aromatase it's an enzyme that converts androgens into estrogen. So when we're blocking that, we're decreasing estrogen. So both are similar, but they work different. They both lower estrogen, right? Which
Mhm.
helps increase the FSH and LH.
Right.
Tamara is newer. It's more becoming more mainstream. You and I've talked about that a little
Mhm.
bit. I think providers are recognizing, and there's a lot of great studies out there that there are better outcomes with Femara.
Yeah.
A lot of it, from what the research I've done or I see, maybe has to do, it could do with the thin lining. Possibly the side effects are less, and people are actually taking it more or taking it correctly. And some people's bodies just may respond to Femara better than Clomid.
Mhm.
I think that we're all different. We're all, our bodies break down drugs differently, and so
Right.
if Clomid didn't work for you, advocate for yourself and say, hey, can I try something different? What do you recommend? So Femara comes as a 2.5 milligram tablet, and it can be given two different ways. It's usually given in 5 consecutive days. So
Right.
like cycles days 3, 4, 5, 6, and 7. That's how I did it. Also, some providers do like maybe cycle day 5 to 9. It depends on the provider and maybe your cycle, the patient cycles, if that makes sense. Um, like I said, less side effects. I took this myself, and I had some side effects, but not like that terrible headache. Mine was more like a little acne on the back, some mood swings, and some bloating.
Mm,
Um, but bloating, blurred vision, breast pain, dizzy headache, fatigue, they're all similar. When we
mhm.
work with that estrogen hormone, we can get some pretty nasty side effects.
Right.
Um, yeah, so and some insurances, I like to always talk about the money component
Yeah.
because that's a
It's
big deal.
important.
It
Absolutely.
is. And some insurances will not cover fertility medications. I always say to people, call your plan, know
Right.
your plan, your insurance
Hmm.
plan. In the United States, we have private insurance, a lot of us. So before you even start this, get a hold of your HR people at your job or your spouse's job and find out your plan and call ahead. But like for me, the Femara was covered. I
Hmm.
just had a copay, but the injectables were not.
Ah,
So, and then also I always like to tell people, look online and always shop around. So
right.
if Walmart gives you a certain price, go to Rite Aid, and then
Mhm.
also look at
Good
GoodRx. They have
RX. Yep.
coupons. Yep. And
I'm
there's a
glad you
new one.
mentioned that.
My husband, I said it before, he's a pharmacist. He has a new job where he's working for a company and he's saving them all this money, trying to with prescription
Right.
drug costs. That's his mission. And
Hmm.
Mark Cuban, if you know him, he was on Shark Tank.
Absolutely. I love Mark
He's
Cuban.
Yeah, he started his own. I wish I could, it's like prescription savings. It's similar to Amazon. You can
Okay.
also get prescriptions from Amazon. So go online,
Oh,
look at those things, price compare. In my IVF planner that I offer, I have like a cost comparison sheet for you to write everything down. I'm a very visual
ah,
writing out kind of
awesome.
person. And yeah, and so like I said, with these, especially with metformin and Femara, when we get to the higher level of injectables, it's a
Mm,
little trickier because they're more expensive, they're brand name,
sure.
not always. But when we're working with the oral medications, a lot of insurances will cover that. So don't
Yeah,
go for your first option. Always shop around.
absolutely. And that applies for, we kind of touched on it with healthcare providers too. But
Yeah.
just think about this for a moment, that we will sit here and we will shop and price compare at Walmart, at all the big box places. We will price compare on cars. We will price compare on like literally everything. But for some reason with healthcare, we seem to stick with who we started with as a provider. And it's interesting. This is like a really interesting culture thing that I find in the Midwest that boggles my mind, really, because we do so much research on stuff, but when it comes to our healthcare, it's not usually what we shop around for. And so I am a huge proponent of taking a look, talking to people, because you have a certain set of values. There is going to be things that you value that your provider may not. I know when I was working with women in the maternity side, this is huge, in terms of finding a provider that aligns with your values. Because if you want a certain type of birth, then, if you want to have a natural birth, then going to somebody who has a 60% cesarean rate is probably not the right healthcare provider for you. Right. So this applies to your fertility as well, getting the right people on your healthcare team that aligns with who you are and what you believe in and what your goals are and what your priorities are right now. And medication shopping around for medications, right? We're in a free market, so do that. It's really,
Yes,
really great.
definitely do
It's
that.
such great
And
advice.
if you ever have questions, I'm open on my DMs on Instagram. Um, and I've been really, really hitting hard this research with my husband for his job, price comparisons, and we're learning about, where with insurance companies and
Hmm.
pharmacy benefit managers, the money's going, and drug companies. It's crazy. And you and I have talked about this a little in the past too.
Yeah.
Um, and I think when I did my own fertility treatment, they offered me their recommended pharmacy and gave me a list.
Oh,
And that
okay.
was nice. And in the moment, I was like so overwhelmed. I'm like, okay, I'll do whatever the clinic tells me. But when I
Mhm.
stepped back, I was like, wait, I can also call Walgreens specialty pharmacy, just Google like
Mhm.
fertility specialty pharmacies. And I just called around and found, some places maybe offer better rebates if you have an injectable drug. Some places offer, maybe better prices, cash price. Cause of course I was not able to use my insurance for the
Right.
expensive injectable drugs. So it's true. I didn't think about that, but I mean, I'll shop, I'll drive across town for a cheaper loaf of bread.
We
So
do. It's so funny. We do. But so it just at the end of the day, it's really important to remember that your health and wellness, this is your journey, your fertility journey. That matters and is worth the time. You are worthy of the time that you give yourself to look for these options. Your life matters, your health matters, your mental health matters, your finances matter, like all of these aspects of yourself matter. And so if yeah, it may take a little time, but that's why we have people like you, Natasha, that you come in and you help people with things like that, maybe giving them some resources. So don't hesitate to like reach out to those that have this knowledge, because you don't have to go at this alone. And I just want to put that out there.
another quick
um,
tip I like to give really quickly.
yeah, absolutely.
When you get your clinic, I would ask, what's the best way to contact you? So say you have a side effect of the medication and you want to talk to the nurse about it. Say, should I get on the portal and message you? Should I email you? Should
Mhm.
I call the clinic and ask for you to call me back? Establish that communication up front. So
Yeah.
when you do have a problem, you're not like, hey, I have a headache so bad I can't get out of bed. Could it
What
be
do I
the
do?
medication? You know
Right.
how to get a hold of them.
That's such great advice, because sometimes in that moment, you do not want to be sitting here trying to figure out how to get a hold of your provider, especially if it's something that, I mean, obviously, if it's emergent, go to the emergency room. I always tell people that if you
Yes.
if you need to go to the emergency room, but if it's something that is important and you want to get a hold of them and ask them a question about your medication, knowing how to get a hold of them is going to be beneficial when you aren't necessarily in need of it at the time, but having that handy, especially, having it next to your medications, or having it, on your refrigerator, somewhere that's easily accessible, especially if there's a, adverse side effect that happens. You want to have that. So I would love to kind of talk a little bit about, briefly about IVF medications. I know this is something that you obviously went through personally, and this is kind of a part of what you do and what service you provide to women is helping them with their IVF medications. So talk to us a little bit about how you would specifically support someone who is going through this portion of their fertility journey, and how you could support them in that part.
Yeah, definitely. So, we can when I work one-on-one with a patient, supporting them on their journey, what I've done in the past is that we get together, we set a time, and we go through their box, like unboxing, and I try to
Hmm.
make it exciting and happy and not a scary thing. And so, we talk about storage and we talk about how to organize and, getting cute stickers and things like that, and just little things that maybe you didn't think of about, you can use ice, but when you do your progesterone and oil, it's not good to do ice because it tightens up your muscle. Just little tips that I've learned over the years with working with patients. And so that might be like our first visit. And then after
Hmm.
that, as it comes closer, I can meet with the patient and their partner, and we can talk about, how to involve your partner. Your whole regimen. I usually ask for them to send me like their medication schedule, like a calendar, and we
Yeah.
go over that together. And then I go in depth on each medication. If the patient's interested, I can talk about mechanism of action.
Hmm.
That is a little bit more advanced, and some people don't want to hear that. They just want to know, how's this going to make me feel? How do I mix this?
Right.
So I offer virtual sessions with that too. So I kind of go with what each person needs, and then we set up different appointments that way. I do a lot of at the last minute, can we video in and we're getting ready to mix this, are we doing it correctly, at least for the first time? And that helps,
Hmm.
I think, a lot. I love doing supplement counseling, where I'll just go over your supplements. I don't recommend, because I don't want to I don't give medical advice
Right.
in this situation. That's for your provider, and you always need to talk to your provider when you're doing any fertility medications about what supplements, but I will look at them with you and we can organize them together and talk about interactions, because
Hmm.
say you're taking a thyroid supplement or thyroid medication and you want to take a calcium supplement, I would talk to you about not taking those together.
Together. Hmm.
Yeah.
Yeah.
So
This is really great because that can be such a daunting place when you have, you go into this journey of wanting to start a family and you don't realize that you're basically going to have to become a pharmacist, like kind of like a lay pharmacist, or like organizing all these medications and understanding and having to inject yourself. Like I remember that was the scariest thing, and I literally couldn't do it. I had to have my ex-husband had to do it for me because I could not. I couldn't do it. I literally was sitting there with the needle in my, for my trigger shot, and I was like, I can't. I cannot do this.
I
So
think I did that too. I remember my hands shaking. I
my
was so
I was
scared.
shaking so bad. I was shaking so bad, and it's like so even just having somebody to support you through that and understand, hey, this first off, this is very normal. This is it's okay. Let's walk through it together. Let's, breathe and just like having that support, like, oh my gosh, like knowing that you are not alone while you're going through this. And your doctor's amazing to, help you guide your kind of overall picture. But time is a really difficult thing when it comes to providers. They don't have the time to sit and talk to you about all this stuff. So, having somebody to support you that has the knowledge and that expertise, and quite frankly, you are one of the most compassionate people I have ever met in my life.
Thank you.
Um,
I love that.
so
Well, and I think when you're at the clinic, I mean, because you
yeah,
could say, oh, well, I get this education from the nurses at the clinic, and that's so true. I understand that. But when you're home, it's way different. Like it's a
it
whole nother
is
ballgame.
so different.
And
It's
just to
so
have
different.
that person at 8 o'clock at night that you can be like, hey, let's meet and go over this before my spouse injects me, um, I think is helpful. And
Absolutely.
yeah, and I just love to help people. And I really want to just spread awareness that, yeah, needles are scary, medications are scary. Like I said, I hate pills, I hate medications.
Right.
But if I didn't have that, I wouldn't have my babies right now. And
That's right.
so I think there comes a point in time, it's a hard turning point. I had a hard time saying,
Yeah.
okay, IVF. I got pushed into it with that cervical ectopic. The doctor was
Yes.
like, no, you can't try on your own anymore. I would have pregnancies of unknown location for no reason. That was my issue. I
Yeah.
think it was my lining and my PCOS too.
Right.
Um, but I kind of catapulted, I call it into that. And
Yeah.
I took a long time to say that was okay. Like, okay, I'm gonna see tear up talking about it. I felt like
It's
my
okay.
body had failed me. And
Yes.
it's hard.
It's so
So
hard.
it is a turning point that you have to say. And some women or families, they are like, nope, IVF's for me. I'm ready. Let's go. And then other women are like, I have to give up that. Almost like I had to give up. I wasn't able to have a natural birth. I from that cervical ectopic, I had so much
Mhm.
scarring in my cervix that I wouldn't
Mhm.
dilate. And we found that out. So I'd have a C-section. So I gave up that
Yeah.
in that moment. And I didn't know I would have to, but you have to just let it go and say, this isn't my fault. I'm doing the best I can, and I'm going to have a healthy baby here. And
I'm
that's the main goal, right?
Yeah, the thing of like feeling those feelings, I think for me, because I spent so long bypassing those feelings of brokenness and feelings of not being whole or not my body not working, and that translated into like this body loathing and
Mhm.
distrust of my body and everything. And it took so many years for me to process all of that. And this is one of those things that I am really passionate about, is helping women process those feelings as they're starting to come up. Because I will tell you, those things like will stay there. They did. They affected me as a mom. They affected me and my marriage and all of these things. And I wish I had known before how much that was going to affect me. And obviously, the journey that we go on is a very personal, and timing and healing is done on its own time. But just like being aware that these feelings that come up, first off, it's okay to feel these feelings. And second of all, just because somebody else is at that point where they're like, yeah, IVF, let's go, and you're having feelings. I remember you kind of said that about your cesarean. I felt the same way. I ended up having, she was breech, my daughter was breech, and I ended up having to have a scheduled C-section, even though I was planning a natural childbirth, and she's my only baby. So I didn't have that experience, and it took a lot of grieving, the processing to go through that part. But there is that letting go, like you said. that letting go of this dream that we have, but still acknowledging that this is our journey and these feelings are also valid. And that is such a huge part of what this is. It's not just about our bodies. It's not just about getting pregnant. It's loss and grief and shame and guilt and resentment and mistrust. It's all of these things and fear. And but it also can be transformed into something that turns into something meaningful for many. I know it's become meaningful for you, meaningful for me, meaningful for so many people that I've talked to. So just having that support. So speaking of support, while you were going through all of these challenges with your IVF and your and emotions and mental health, what helped you stay grounded? What helped you stay connected to yourself and to your partner, to your life while you were going through that?
I I wish I could say I wasn't. I was a
Oh,
mess. I'm gonna
well,
be
that's
honest.
very honest. I love that.
So my situation was in 2012 was my first miscarriage, and Instagram was a baby then, right? It was
Right.
mostly just pictures of our dog and our food. And so I remember having that cervical ectopic and searching cervical ectopic positive outcomes. I wanted to find one person that had a baby after that. That was pretty bad. And I got on this like community baby center forum, and there was one girl I found, and she messaged me, and I was so thankful um because I just needed that hope, that minute of hope, right? And I think that's what
Yeah.
Instagram, and I'm saying Instagram because that's my main platform, but
Hey, it's
TikTok,
mine
any
too. I get it.
where we can share our stories, we're just giving each other hope. And
Yeah.
I love using my mantra. I always said was don't give up. Like my husband always say our last name is Stamper. He says Stampers don't quit. So we don't quit. And I've always had that like burning in my heart of I'm not going to quit. I'm going to give my all. And maybe it's my perfectionist and that can be bad too, but I got in trouble from some trolls on the gram once because she said it was toxic that I said don't give up, but that was my personal thing and I use that a
Sure.
lot. Excuse me. And at the time we were living in a remote Alaskan village. We couldn't drive, we had
Sure.
to fly. We worked all the time. We were baby pharmacists and trying to pay off our student loans. And my husband and I didn't know what we didn't know what to do. We didn't know we were newly married. We didn't know how to talk about it. We didn't share it with our family much other than we had a loss. We didn't share it with our friends
Right.
because, and he shared with me now he felt shame because,
Hmm.
well, and I think he wanted to support me, but he didn't know how, right?
That's
So
absolutely one of the hugest parts.
he can't fix it, right? He's a
No.
fixer.
Right.
So
And so many of the partners that we have in our relationships, like they want to fix us. They want to help support us and they can't fix it. They can't fix that brokenness. They can't. That's all
mhm,
inner work. That's all things that we have to do inside. Um
yeah. And
yeah.
it's hard. I think so he recognized
Come on.
he looked at me and he was like, "We're getting you into counseling." Like, and I was like,
Mm,
"Okay, that's fine, but what about you? You need counseling." And that evolved later. It took a while, and it was hard because there wasn't a lot of services where we lived, but we did find somewhere. And I started seeing a counselor, and that for me helped.
yeah.
She gave me some tools like my anxiety. Just I'd had so many like negative ultrasounds that just getting undressed and sitting in the room, I would panic. And
Oh
so she
wow.
taught me about tapping. So I would tap,
Yep. Mm-hmm.
and she taught me like to speak up to say please don't leave the room for a long time. I get a lot of anxiety with these ultrasounds. If you could just stand at the door in. Um, so advocating for myself, which is hard for me. I don't speak up. I don't want to put anyone out, right? So
Sure.
I've learned that over the years. But yeah, and then I guess just trusting, and that's so hard. That's so
It
hard.
is.
It's
It
so out of our
is.
control. I
That's
wasn't good at that either.
It's well, it's always we always have like this hindsight, right, of how we handled it. I look back and I'm like, oh my God, I was a freaking mess. I shut everybody out. I
Yes,
didn't
I
talk
did
to my
too.
mom because my mom didn't ever have any problems getting pregnant. None of my sisters had ever been pregnant. I didn't have anybody in my close circle that had ever gone through anything like this. So I completely isolated myself from everybody. And honestly, I didn't start seeking counseling for all these things until many years later. And so I spent all that time just being alone. And that was really, really difficult. Well, I appreciate you being so honest about how you felt. And I know that it's maybe I would love to ask what you would say to yourself going through that back then. I know you mentioned, don't give up, but how could you kind of bring yourself that comfort now, um, that you needed at that time?
I think I would not be so hard on myself and just tell myself to love myself a little more.
Yeah,
I was very, very hard on myself
yeah.
and negative thought.
Mm-hmm. Absolutely. Telling yourself like, hey, it's not your fault. You are not broken.
Mm.
This
These
is,
things happen and we don't
these
know
things,
why.
yeah,
And
we don't know why.
and to be okay with I don't know why, because I think unexplained infertility it's hard. Like I don't have a reason, but
Yeah.
there's a reason something's happening. I'm not
Something,
having a baby.
right. There is a reason, but sometimes we don't know those reasons, and we're never going to know those reasons why things happen the way they are. But there is a point where we can kind of um, release the burden of the guilt, right? Or saying that it's our fault or placing the blame on us. Of course, we can always do what we can to support ourselves, to love ourselves more, to, eat better or move or reduce our stress or take the supplements or do the things that we need to do to help support our bodies. But ultimately, at the end of the day, the love that we give ourselves is the most important thing that we could ever do for ourselves in any part of our journeys, whether it's while we're going through, challenging relationship stuff, fertility, or any obstacle that we have in our life, being able to do that. And that is such a big message of mine.
Yeah.
So I have loved this conversation. It has been absolutely amazing. For those of you that are listening, Natasha has a free medication tracker for fertility treatments. You can access that at the after the summit. Of course, it's included in the email, so make sure you check that out. Of course, her Instagram handles is remind me again what it is.
Yeah, it's fertility_pharmacist.
Got it. Okay. And I'll have that under there as well. So make sure you reach out if you've got questions. Of course, she can't give you medical advice, but she can always talk to you about medication side effects or any general questions that you have. And if please reach out to her. She is a wealth of information and it has been a pleasure. So thank you so much for coming on and
Thank you.
speaking with us today. It has truly been a blessing and look forward to many more collaborations in the future.
Thank you so much.
You're welcome. Have a nice day.